Hey there, it's Dean from sciaticreliefnow.net, and I've been getting some emails and inboxes from people who are coming back from doctor's offices after their MRIs, and they show bulging discs, herniated discs, and different degenerative processes going on in the spine. And the overall arching question is, do I have to have surgery to take care of this? Surgery is obviously the most invasive way to take care of this, and if your symptoms are not such that the nerves are being so pinched that you're losing strength, that you have what they typically call drop foot, when every time you take a step, your toes can't lift up and your foot just slaps down on the ground. That's called drop foot. If you're not getting numbness and tingling in the saddle area where you sit, and if your pain is not to the point where you're able to function, then surgery is recommended. But if it's something that's tolerable, something that you've been dealing with, something that is not progressing and getting worse, surgery for that should be the last resort. There are lots of conservative treatments, much less invasive than having surgery. Start with some physical therapy, start with some chiropractic possibly, start with some massage therapy. People do injections, take anti-inflammatories. The only problem with taking medications consistently for a problem like this is if it is masking the pain. If you're taking a lot of anti-inflammatories or a lot of pain pills or a lot of muscle relaxants, what you're doing is you're masking the true symptoms that you have, which allows you to be able to do more activities. The problem is you may be doing more damage at the time that those medications are active and not even know it, and when the medication wears off, the pain is that much more intense because you've irritated something that's already irritated. So the best thing you can possibly do is, if it's tolerable to function without medications, that is ideal. If you need the medications to function, by all means. I am not here to minimize your pain or your problem. I'm here to try to help. The best thing you can possibly do overall is to avoid surgery, simply because there's so many side effects, so many things that can happen in a surgery that you can go online and read about failed back surgeries, people having significantly more pain in their back and progressing into the sciatica symptoms. That is not for everyone. There are some people out there who I know who have had surgery and who are so grateful. Long-term studies are showing that if you have one back surgery, you are significantly more at risk for having to need another surgery than if you never had the first one in the first place. So my goal as a physical therapist, my goal as a friend and as a sciatica expert is, please, please, please do all you can to try to avoid surgery if necessary. And if you're losing, like I said, if you're losing strength, if you're losing sensation, if you are losing bowel and bladder control, by all means, get this taken care of surgically. But there are exercises you can do. Feel free to look at my other videos. I'm here to try to help. I have videos out to try to explain compensation motions, what you can possibly do today to try to minimize your pain. So please take advantage of those. And as always, if you have any questions or thoughts, please email me at info@sciaticreliefnow.net. I hope you have a wonderful day. And like the sign says, life is short, so eat dessert first and enjoy yourself. Have a great day.